Welcome to Stone Mountain State Park in North Carolina for another training segment of Ask Vince. Vince, today we're going to be going over internal and external lashing of a basket. Would you show us through this process?
Yeah, no problem, Carney. Anytime we're working in the vertical environment, trying to move a patient up or down, we want to make sure our patient's securely fastened into the appropriate stretcher. Today we're going to be using a heavy-duty Stokes basket. Basically, we're going to use the basket and either two 25-foot pieces of body cord or two 25-foot pieces of webbing, or in this case we've got one of each so we can demonstrate. Both are appropriate for lashing.
Well, there's been controversy in the past when starting this. Obviously, we're going to get to the halfway point of the 25-foot body cord, but some people are still crossing the feet or pulling down tight on the feet. What do we try to teach as far as that goes now?
Well, we typically don't like to cross it exactly around the feet. We like to go up to the bars on the side. And the reason for that is if you actually cross it across the top of the feet, once the victim's weight starts pressing down and it loads, it constricts the feet, and the bony prominences of both ankles are pressed against each other, especially if you don't have a leg divider, and it's very uncomfortable for the patient.
Could end up causing circulation to stop going to their feet if pulled tight enough.
Oh yeah, and like I say, you don't want to create anything that's going to be that uncomfortable. The patient's going to be uncomfortable anyway. They're not typically used to being restrained and in a basket. Something else has already gone wrong, and then this is just something else to add on to it. So we want to try to make the patient as comfortable as possible.
All right. Again, the first thing we're going to do with this is find our center point of our body cord. And we'll simply sit that center point at the victim's feet. Matt's going to hold that in place as I get the first rope started.
Now, depending on the basket configuration and the manufacturer, the pin configurations are different on various baskets. So what you're going to need to do is you're going to be looking for the larger pin, if possible, that travels vertically. That's typically going to be the strongest pin. And we're going to just lash this cord to the outside without ever traveling over the outside, the top rail. We want to try and keep this top rail as sort of like a rub rail, and that will prevent any damage to the rope in the transition and when you're moving across sharp edges of the rock. And right here is an important point. You don't want the victim's hands to be free. A lot of times the victim's going to ask you, can I have my hands out? We typically don't like to do that, because what that can do is allow the victim to grab a hold of a tree limb or grab hold of a piece of rope or something else which can throw the basket off. They actually could get the system locked up and require you to have to do something to free the system. So it's a little uncomfortable for the patient, but it's a real good idea to make sure that their hands are securely lashed in the basket. And you're going to take this last one, is going to crisscross and tie off with a split lock and clove hitch on either side around this vertical pin. We don't come straight back across. The reason for that, if the basket were to get tilted over or twisted or whatever, we don't want anything coming straight across the deck and creating a potential suffocation hazard or something that could strangle the patient.
Vince, one other thing that we get asked a lot is, and seems to cause some confusion, when you're tying this off, should you start at the head side of the pin or the foot side of the pin?
That's a good question. Typically we like to start at the head and travel over the horizontal rub rail of the basket, and we're going to split this right here, and then we're going to travel back to the bottom to finish off the split lock and clove. The purpose of this is the load is typically going to be pulling in this direction, which is going to create a load on the knot, which is going to force it to lock into the pin. If you were to start on the bottom, then this piece would be from the bottom, and the more you pulled on it, the further apart it's going to pull that clove hitch, which is going to make the clove hitch loose.
So what we're going to do is Matt's going to tie his side first, and then we're going to take up all the rest of the slack throughout the rope all the way back to the feet and back up to my side, in which I'll do a final split lock and clove, which will lock the external lashing in place. And this does not have to be so tight that it cuts off circulation, but we do want it to be tight enough where if the basket were to become inverted, obviously the person wouldn't be feeling like they're falling out of the basket. And we'll simply finish off. Overhand split lock and close. Don't forget, on all of our knots for our safety, we do an overhand knot for the safety of our rope. And again, any external can be tied again or placed down in the basket neatly out of the way to keep it from hanging. At this point, we're ready to add whatever kind of rigging we'd like to, whether we want to do a horizontal or a vertical lower. Now that we've completed the external and the internal lashing, we're going to show you just how much it holds them in place by standing vents up. 1, 2, 3, lift. As you can see, Vince's body really had very minimal movement inside the basket. So if we were to do a vertical or horizontal lower, and if something got jerked around, his body is secured to the basket well.
Yeah, Carney, I'd say that I didn't move a bit. I think y'all done a pretty good job.
Tune in next time for another episode of Ask Vince.